What if AI could diagnose you better than your doctor? One story on X opened this little issue up this week, and it got 7.5 million views and over 2,200 comments. On July 24, 2025, Nikita Beer posted on X about a life-changing ER visit involving a friend of his. Struggling with symptoms, he turned to AI to research his friend's condition and then took him to the ER. The AI suggested 4 lab tests, and in the ER the doctor agreed to 3 but thought the 4th was unnecessary. He insisted, and guess what? That test was positive. And the post created some arguments about the narrative. The specifics of the situation were not given, but the post brings up some interesting issues about the use of AI in healthcare. Artificial intelligence is transforming healthcare. A 2025 study in Proceedings of the National Academy of Sciences found that teams of humans and artificial intelligence diagnose with unmatched accuracy, catching errors that doctors miss when working by themselves. Microsoft's AI Diagnostic Orchestrator scored 85% on complex cases. That was 4 times better than seasoned physicians. From spotting lung cancer to streamlining hospital workflows, AI appears to be a game changer in healthcare. A Newsweek article from 2024 said 51% of healthcare pros expect patients to self-diagnose with AI in just a few years. And with doctor shortages up to 124,000 by 2034, AI could be a lifeline. But here's the potential monkey wrench: licensing boards. These gatekeepers decide what's ethical for doctors and nurses in healthcare. Historically, they've punished providers for stepping outside traditional practice. As economist Milton Friedman warned us in the 1960s, calling licensing boards monopolistic barriers. A 2014 William and Mary Bill of Rights Journal article by Carolyn Cody argues that boards can overstep, revoking licenses for reasons unrelated to skill, potentially violating constitutional rights. Will boards embrace AI or call it unethical? Some worry they'll demand FDA-approved AI platforms get licensed like doctors, creating red tape that slows innovation. The FDA has approved over 700 AI tools, but boards might insist on strict oversight, fearing errors or bias. What if the ER doctor refused to order that 4th test? If the patient's AI data was correct, could the doctor be sued for negligence? Medical malpractice law hinges on the standard of care, what a reasonable physician would do in that situation. If AI becomes standard, ignoring it could be risky. A 2025 JAMA Network Open study showed AI scribes cut documentation time, becoming part of routine care. If patients bring AI-driven evidence, dismissing it without reason might expose doctors to malpractice suits, especially if harm occurs. Cody's article warns that arbitrary board actions could harm patients by limiting provider autonomy, and punishing AI use might drive talent away and worsen doctor shortages. What's next? The AMA says AI should augment, not replace doctors, but boards must adapt. Will they mandate AI training for licensure, or will they cling to old rules and stifle progress? Patients are already using AI, and 40% of consumers want it for better access. If boards don't evolve, they risk harming the public, as Friedman feared. Could AI save your life, or will licensing boards hold us back? Share your thoughts. Should doctors face liability for ignoring AI? Like and share this video, and don't forget to subscribe to or follow Health Without Risk, where we explore options for better health you won't hear from mainstream medicine, but you just might hear from a chatbot. Health reimagined, risk removed. See you next time. Bye. Thanks for watching.